Hi, my name is Tina Trong, and I will be presenting to you today on the topic of limits of viability of extremely premature babies. Before we get into this topic, it is important to define viability. According to Nadru, viability is defined as sustaining life outside the womb with or without medical assistance, which is determined by gestational age, birth weight, and the condition at birth. However, with advancements in technology over recent decades, there has been an increased chance of survival for infants born at lower gestational ages compared to the past. For instance, gestational age at which at least half of the infants survive has decreased from 30 to 31 weeks in the 1960s to 23 to 24 weeks in 2011. Although this statistic is from a decade ago, this should prove that survival rates of extremely premature infants are still increasing since advancements in technology are continuing to be made. Regarding this topic, there are two sides of the controversy, which is resuscitation versus no resuscitation. The stance behind resuscitation is the belief that premature babies could survive as long as they have extensive medical intervention. This is due to increase in survival rates of these babies, like I had mentioned earlier. With the increase in survival rates, we could assume that this is due to more resources being available to care for these preterm infants, hence the reason as to why resuscitation should be initiated. However, the opposing side of this stance is no resuscitation. The reason behind no resuscitation is the belief that even if these extremely premature babies survive with extensive medical intervention, there is an increased risk of developing chronic medical problems and disabilities once they leave the NICU. Therefore, it is important to implement new guidelines for resuscitation and performance of CPR that are up to date, since survival rates of extremely premature babies born at lower gestational age has been increasing in recent decades. According to Stanek and Hollick, globally less than 1% of pregnant women give birth extremely preterm. Although this statistic is relatively low and may not be that significant, however, it is important to consider the actual number of babies that are born prematurely. For instance, in 2006, 1,185 babies were born less than 28 weeks in the UK, whereas 350 infants were born extremely premature in Austria in 2016. As for the burdens in the healthcare system, this usually falls onto the doctors and the healthcare team that care for these infants. It is important that doctors make sure that parents are making decisions that are in the best interest of the child. This is especially important in situations when parents go against medical advice. In addition, the cost of care in the NICU for an extremely premature baby could also be a burden on the healthcare system. For instance, low birth weight infants incurred more than one-third of all infant health care costs in the first year of life in 1988, which correlates to $4 billion out of $11.4 billion spent for all infants. As for costs associated with the controversy, there are costs that affect both the healthcare system and the family. For the healthcare system, there are costs that they must face when it comes to caring for these extremely premature infants, especially in the event that these infants develop chronic medical problems or disabilities. This could be medical resources, supplies, and/or services that would be offered to parents to care for their child. There could also be emotional and financial costs that these families will have to deal with. When parents decide to resuscitate, they must face the fact that there is a high chance that their child may develop disabilities due to stress from the initiation of resuscitation. As a result, this can become emotionally and physically taxing on the parents, since they will constantly be worried for their child. In other cases, this could become financially difficult for some families, since some may not have the financial means to pay for all the costs and resources that their child may need. So why does it matter? This is because health outcomes of extremely premature infants are highly unpredictable, like in the event of Richard Scott William Hutchinson, whose parents were told by doctors that their son would have a 0% chance of survival after he was born 4 months before his due date at only 21 weeks gestational age. He defied the odds of medical uncertainty and was recently able to celebrate his first birthday in June 2021. This prognosis was made on the basis that the healthcare team had never resuscitated anyone younger than 22 weeks, and they did not have the experience or the resources to provide optimal care for the child. Due to this, it has raised questions regarding what the guidelines are when it comes to resuscitating babies born prematurely, since there is so much medical uncertainty. Depending on the guidelines for resuscitation, this will affect whether or if doctors should initiate a resuscitation of extremely premature babies, and it could possibly be the reason why they make such prognoses about the health outcome of the child, despite such medical uncertainty, since the current guidelines essentially tell them what gestational age is appropriate to not initiate resuscitation. Therefore, my thesis statement regarding the controversy of the limits of viability of extremely premature babies is that survival rates of extremely premature babies have been increasing in recent decades. Therefore, healthcare professionals should implement newer guidelines that are up to date regarding resuscitation of extremely premature babies based on gestational age and or birth weight. In the next slide, I will talk about the ethical principles that are in conflict when it comes to this controversy. Ethical principles in conflict are autonomy, utility, and justice. Autonomy is the respect of an individual's rights to make their own choices. So autonomy in this sense is that parents have a right to request all treatments and interventions for their child, since they are the surrogate decision makers. Utility is the attempt to bring about the greatest amount of benefit to as many people involved as possible. In other words, what decision would result in the greatest benefit and the least harm. Utility in respect to this topic is that routine resuscitation of extremely premature infants may not lead to the best outcome for society. This comes into conflict with autonomy because if parents decide to go forward with resuscitating, this may not be the best decision since there is a high chance of the child developing chronic medical problems, which also means that more resources would be allocated towards care for that infant. Lastly, the idea of justice is to treat patients equally and fairly regardless of medical condition. In terms of this, extremely premature infants should be allocated the same resources as any full-term baby, since they are still people. However, this comes into conflict with the idea of utility because now healthcare professionals have to determine whether resuscitating would be beneficial for society. In other words, things start to become difficult, especially in situations when extensive medical intervention can bring more harm than good to the child. In terms of professional codes, the Code of Medical Ethics should be directed at, specifically the ethical principles of autonomy, utility, and justice that I had just previously talked about in the previous slide. When it comes to regulations or laws that are applicable to this controversy, the baby doll law should be considered, which was an amendment to the child abuse law that was created in 1984. This law is significant because it extended the definition of child abuse to withholding fluids, nutrition, and medically indicated treatment from disabled children. In other words, this law stood for the idea that extremely premature infants are still people, so they should be allocated just as many resources that a full-term healthy baby would have, which ties back to the ethical principle of justice. Lastly, some of the institutional policies that are applicable are the Guidelines of Resuscitation and Performance of CPR issued by the American Academy of Pediatrics, the American Heart Association, and the International Liaison Committee on Resuscitation back in 2008. For instance, the AAP and the AHA published conditions that were appropriate for non-initiation of resuscitation in 2000. Amongst the conditions were confirmed gestation of fewer than 23 weeks or a birth weight less than 400 grams, and a confirmed gestation of 23 to 24 weeks with assessment of either infant's condition or parental choice or both. These conditions served as a guideline and helped doctors in deciding whether it was appropriate to resuscitate or not. However, even with the guidelines, there was agreement that there is still much medical uncertainty, and determining whether to resuscitate should not solely be decided based on gestational age or the infant's birth weight. Even more, the International Liaison Committee on Resuscitation recommended situations when CPR should be performed in 2008. For example, CPR was recommended for all infants with a gestational age of 25 to 26 weeks in absence of major congenital anomalies and in infants 23 to 24 weeks upon parental request. Although these guidelines can serve as a way for the healthcare team to determine what is the best course of action in terms of resuscitation, medical uncertainty will always be of concern. Since there's a degree of uncertainty with health outcomes of these infants, a discussion between parents and physicians should be held before making decisions regarding resuscitation or continuing care. The best resolution to this controversy, especially when there is so much medical uncertainty on the health outcomes of extremely premature babies, is that the American Academy of Pediatrics, the American Heart Association, and the International Liaison Committee on Resuscitation should update or make fewer guidelines for healthcare professionals to follow when it comes to initiating resuscitation and performing CPR. This is the best resolution because the survival rates of babies born at lower gestational age have been increasing over recent decades. This is probably due to advancements in medical technology being made and that healthcare professionals are getting more experience from taking care of these premature infants. Therefore, guidelines regarding resuscitation should reflect the improvements that have been made over the years and should consider that there are more resources available now to care for extremely premature infants compared to the resources that were available back in 2008. Lastly, my personal recommendation in trying to resolve this controversy, or at least lessen the burdens that both the healthcare team and the parents may face, is to have a plan set before delivery, especially in cases when the mother has already been told about the complications that she may face during the delivery due to her personal condition like gestational diabetes, or if the baby was found to be in a breech position prior to labor, which is when the baby is lying bottom or feet first instead of head first. Although there's a lot of unknowns prior to the birth, having a plan about the different outcomes that could come about on the day of delivery could help guide the healthcare team and the parents to decide what is the best course of action, not just for the infant but for the mother as well. For instance, determining whether the parents want full treatment or intervention could help save the trouble of medical equipment needed to care for the infant, especially in situations where they know about the complications that may arise due to prior prenatal checkups. However, this should only be considered as a recommendation because there is so much medical uncertainty and parents make decisions that are driven by the outcomes that their doctor provides them with. In conclusion, autonomy is the most important ethical principle to abide by. The reason for this is because we have to assume that parents are making the best decisions for their child. Although there may be situations when the parent may go against medical advice, healthcare professionals should respect the decisions that the parents make because they are the best at judging whether they can care for their child or not. This brings it back to Richard Scott William Hutchinson. Although his parents were told that their son would have a 0% chance of survival, they still went forward with having their son receiving full intensive care, and as a result of their decision, their son was able to celebrate his first birthday a few months ago. This goes to prove that health outcomes are uncertain, especially when infants are born prematurely. Therefore, due to medical uncertainty and the long-term consequences that both the child and family may deal with, healthcare professionals need to update or make new guidelines regarding resuscitation of these extremely premature infants, since parents will make their decisions based on the outcomes that have been given to them. It is important to develop newer guidelines in regards of resuscitation of extremely premature infants because these guidelines will provide standards of practice which could support healthcare professionals in counseling parents and potentially minimize the moral distress that both the healthcare team and the parents may face. And finally, here are my references for this topic, and thank you for watching.